This is going to be a great way to build hip internal rotation and range strength with a passive range liftoff. So what we are going to do is put ourselves in our passive range of motion where we wouldn't be able to move our limb or perform the movement. We're going to find the muscles that would perform the movement we're training. We're going to ramp them up to a hard contraction. We're going to come out of the end range and we're going to try to move that leg with us. And we're gonna stop at the position where we can actually lift our leg and we're gonna hold it. That is the lift off part. So for this movement, we are going to find hip internal rotation and range. You wanna be on a box. Higher is going to put you in more abduction. It's gonna tense your adductors a little bit more, so you may want to be on a lower box, totally fine. The height is just going to change how difficult and how much strain we have on our adductors. You also may wanna find a wall or something you can hold on to if your balance isn't the best. From there, you're gonna want your knee at about 90 degrees. I also like to tend to like to keep the ankle at 90 degrees as well. From here, the movement we are doing is hip internal rotation. So that is thinking about this thigh rotating this way. So this is what the movement looks like as I do that. If you are unfamiliar with those muscles, you're going to think about rotating your foot and ankle out, rotating that thigh in, feeling these tissues. Once you set up in your position, you're going to find your end range of motion. So we're gonna wind into that end range of motion. Here, I'm gonna try to do the movement. I can't unless I try to bring the rest of my body with me, which is perfect. From there, you're gonna avoid any closing angle groin pain. We're gonna feel our glutes and that side butt stuff squeeze to rotate our hip. We're gonna slowly come out of that movement, trying to lift our ankle and bring it with us until we're able to lift just a little bit off the ground. You might feel some cramping, hold for 3 to 5 seconds, then slowly try to keep the ankle up, rotate back into that, fighting for that movement the entire time. As you go back, your ankle will fall. I just want you to fight it so you really work on those movements or that muscle. So one more time, find that end range position, really wind your hip back into that internal rotation, lift the ankle or think about it, squeeze those muscles, slowly rotate back out, try to bring the ankle off the table with you, hold at that spot where you're able to, pause for that amount of time, try to keep the ankle up as you rotate back, and now we're at the back end of the position or the start position and we relax the muscles and reset. You're gonna perform that for the prescribed amount of time and the prescribed amount of reps, typically about 3 to 5 seconds for about 3 to 5 reps, until you feel like you're super fatigued. It is very normal to lose range of motion and have to come further out of it as you go. Just try to fight through some of the cramping as well. That is normal. It just means a lack of strength in this position. You should notice that getting better as you do this on a week-by-week basis.